class, we're here today to talk about childhood onset schizophrenia. So let's get into it. What is this? Basically, it is schizophrenia, but with children. It's just the same exact symptoms. However, this has to be diagnosed prior to the age of 13. So we have both positive symptoms and negative symptoms, have to have a combination of them. But positive symptoms are things like psychosis, so things that we've heard about, hallucinations, delusions, so hearing or seeing things that aren't there or believing something that is not true, disorganized thinking or speech pattern, abnormal motor behavior, so things like being extremely slowed down or speeded up and maybe having jerky movements. Negative symptoms seems a lot like some symptoms of depression, right? So blunted affect, so not having, expressions on your face or maybe abnormal expressions on your face for the situation, having a lack of motivation, anhedonia, that lack of feeling positive pleasure in anything, actually having diminished speech capacity or a diminished interest in social interactions. So referencing my lovely, handy, dandy DSM-5, you have to have at least two of the symptoms, so things like hallucinations, delusions, disorganized speech, or negative symptoms, for 1 month. And that is the active phase, but the should be that you have some sort of symptoms for 6 months. So you need 2 of them to be active for an entire month, or less if it is treated. It is exactly the same criteria for childhood onset schizophrenia. So we kind of think about childhood onset schizophrenia as being on that continuum of what schizophrenia really is for adults. So one of the difficult things we have to do is figure out, well, is this actually schizophrenia or is this just psychosis? So psychosis is really defined as any loss of contact with reality. So that could be things like hallucinations or delusions. But psychosis itself could be present in many, many disorders. So things like bipolar disorder, sometimes you will have, either during the depressive episodes or during those manic episodes, you can see hallucinations or delusions. And that could be, just a symptom of that manic episode, let's say. So one of the things about psychosis is that it's relatively common in children. It can be as high as 5% in children. But that doesn't necessarily mean that they have a diagnosis of schizophrenia. So just because you see, that child is having a hallucination or a delusion doesn't necessarily mean that they actually meet criteria for schizophrenia. So remember that schizophrenia has more of that spectrum of positive and negative symptoms that occur together. And you see that the incidence of this is less than 0.04% in children. So it is really, really uncommon compared to all of our other disorders. And the process of actually diagnosing a child is quite difficult. So the National Institutes of Mental Health, which is a really big institute in Washington, D.C., has been running studies trying to look at how common this is and what the best treatment options are, those types of things. And what they find is that a lot of the patients who are actually referred to the study come out to not have schizophrenia. And these are, children, before the age of 13. And as many as 30 or 50% of them are actually misdiagnosed. So they had a diagnosis of childhood onset schizophrenia, but they really actually have some other psychotic symptoms or they have some affective disorder. And one of the ways that they're trying to really show that the diagnosis is true is if you take away all medications, so they taper them off, they don't do it all at once, they want to see whether or not, hey, does this child still show some sort of symptoms of schizophrenia? And what they really find is that almost 40% of them no longer meet that criteria. So what we're really seeing is that this is a really difficult problem of actually diagnosing a child. It's not as easy just saying, yep, you meet criteria. Actually going through the diagnostic process is really tough. And you can imagine if you're only seeing 0.04%, you might go your entire career as a therapist and never see a child with childhood onset schizophrenia. There is a chance that you will, but you might go your entire career without seeing one. So we really think that childhood onset and adult onset schizophrenia are pretty similar. So typically, adult onset schizophrenia, it's somewhere around the late teen years to early 20s that we start seeing the onset of schizophrenia. But when we're talking about that childhood onset, we really see a lot more risk factors. So they're more likely to have a comorbid developmental disorder, things like autism, more likely to have brain abnormalities, as well as having a higher genetic loading for schizophrenia. And one of the things that often happens before a child has been diagnosed with schizophrenia or before they meet full criteria is that they have been showing some sort of symptoms going on prior to that occasion. So this might be so we call this pre-morbid, so before the diagnosis. So might have trouble with social skills, depression, having a lot of suicidality, aggressive behaviors, potentially theft, manic-like or bizarre behaviors, and struggling in school is actually one of the key things that we start seeing beforehand. But as we've been talking about in this class, struggling in school is something that's common across a lot of different disorders. So I want us to watch this video from the Child Mind Institute that talks about what are those first signs that we start seeing with childhood schizophrenia, because I think it's really enlightening and kind of helps to understand a little bit more about what's going on.
In most cases, schizophrenia occurs primarily, the onset is in adolescence and in young adulthood. But childhood schizophrenia does occur. It is much more infrequent than the later onset schizophrenia. In most cases, the onset is actually quite gradual, and a child might become, or a young adolescent, might become more isolated. Child might appear to be having difficulties with attention because they're actually paying attention to internal stimuli such as the hallucinations or to their delusional thoughts. In other cases, the children might appear very anxious because it is a very, very scary experience for a child to have a hallucination. Number one, because sometimes the content of the hallucination is very threatening, like, I'm going to kill you, or accusatory, you terrible child, you have done the most terrible things. And children at the beginning of the onset of the disorder understand that this is very unusual because kids from about age 5 plus know that one doesn't hear voices when no one is talking, or one doesn't smell smells that nobody else can smell. As a parent, what you might experience is your child is being either on the one hand very anxious, or because from their perspective you don't understand what's going on with them, they might actually act out and be very irritable and very angry. Schoolwork might go downhill because the child is having a lot of difficulty paying attention and retaining what they are learning. And another very important symptom of onset would be difficulties with sleep. Child might have difficulties falling asleep, which is part and parcel of the disorder, but also might occur because in the evenings these hallucinations seem to be more apparent, or when the child is alone and no one is around to sort of dull whatever the experience is, the child is experiencing the hallucinations and getting very scared. So again, you as a parent might think, oh, my child is being rebellious and not going to sleep, And you might get angry at your child, but in fact, the child is being very anxious and wants to be together with the parent to protect them.
So now that we know a little bit more about how a child, may have difficulties before they even have a diagnosis of schizophrenia, let's just talk about like what are those causes and risk factors. So what we see is that, having a maltreatment in childhood is it's just like a traumatic event. It makes the likelihood go up that a child might develop schizophrenia. So that neglect, I think, is associated with like negative symptoms, and maltreatment's associated with positive symptoms. So, it really is an important factor here. Just like in adult onset schizophrenia, having prenatal exposure to some sort of illness like the flu or rubella virus in the first trimester actually is related to childhood onset schizophrenia. So we think that there's something going on in, how the embryo is developing that may lead to schizophrenia happening. Family history is a really big component here. We do know that this runs in the family. Schizophrenia itself is highly heritable, and that's the same thing with childhood onset. We also think that having an older father or a paternal parent is related to COS because of genetic mutations that are happening in the sperm. So that's one of the theories about why this might be happening. And we see abnormalities in brain structure, like enlarged ventricles or poor pruning, might put somebody at risk for psychosis and COS. So once diagnosed, unfortunately, the prognosis or what's going to happen afterwards is typically poor. What we see is that schizophrenia symptoms continue across the lifespan. So it's not just that it stops at the age of 15 and they're done. Instead, it seems to really continue into adulthood. You see a higher risk of not completing secondary school. You can imagine that if you are, 6-7 years old and having poor premorbid functioning, so maybe not doing so well in school already, now you have the diagnosis of schizophrenia and you're experiencing all those symptoms, you may be losing out on a lot of your education early on. So unfortunately, this does lead to a higher risk of not completing secondary school, as well as a higher suicide rate. And yeah, that's unfortunately the case here. But there is treatment. There are treatments that are out there. Typically, there seems to be antipsychotics that are used with children who have schizophrenia, and they help to decrease things like, your positive symptoms, so hallucinations and delusions. So that might actually help with allowing that child to do things like be present in school, right, and actually think through things. You also have other therapies that are out there, so doing individual therapy or family therapy, so things like knowing about expressed emotion in families, maybe really treating and figuring out what's the best way to support that child within the family. There's also a lot of skill building that can be done to help regain some of those skills that they may have not been able to do while they've been having this an active, schizophrenia episode, for example. So that is all I have for you as just a quick and dirty what is childhood onset schizophrenia. There's a really great TED Talk that is going to be the next video that you're going to be watching that really talks about what are the ways that we can do early interventions with psychosis. So it's a little bit broader than just schizophrenia, but all of the things that she reports in there are things that I think are really important for us to think about in general, but also when we're thinking about treatments. So I hope you enjoy. Bye.